Yeah, I just maybe give you a little bit of brief outline about how the book came about. And it goes back to when I was 21. I saw an advert in the paper and it said driving instructor wanted. And it wasn't so much that attracted me, it was the bit at the bottom which said you could take the car home in the evenings and use it for your own use. Okay? Okay. I didn't have a car at the time, and I thought, well, this is a good way to get a set of wheels very easily. And I started to teach people to drive. I thought it was going to be something I would do for 6 months or a year, but I ended up starting having children. They needed to be supported, so I suppose I got stuck in the job for about 10 years. And after about 2 or 3 years, the back pain sort of started, and then it was just a niggle, a bit uncomfortable in the evenings, and then it got worse and worse and worse and worse and worse. Okay. My father actually was a GP, and he used to say, this is before I had backache, he used to say, look, if you ever want a day off work, just say you have back pain. Because nobody can prove you have, nobody can prove you haven't, and what is more, nobody can do anything about it. Okay? And when I got my back pain, I realized how true that was, that actually nobody could do anything about it. So it was like I went to see him. I didn't have to sit in a surgery, wait for 3/4 an hour, and then go in and out in 3 minutes with the painkillers or muscle relaxant. There was nothing anyone could actually do. So I went to the doctor and he gave me the painkillers, then it was a muscle relaxant, then it was something else, and then it was a physio, and then it was the orthopedic surgeon. And then what actually happened was they injected this radioactive fluid down my spine. It's kind of blue in color, and they said, I'm really sorry, but the 3 bottom discs are completely shot, and the only thing that will ever get you out of pain would be to remove the discs and have fused vertebrae, the last 3. So I just thought, well, if that's the only thing that's going to get out my pain, I might as well do it. Okay, so I signed up for the operation, and it was only because my father said, whatever you do, don't have the operation, because I see the people afterwards. Okay, I see the people afterwards. So whatever you do, don't, because most of them are worse afterwards than before. Okay, and that was actually supported by my wife. Actually did she was an IT, she got a master's in IT, and for her research project she actually talked to all the back surgeons in Frenchay Hospital in Bristol. And what they actually said was to her, please don't say anything to anyone else, but when we put the knife in, we have no idea in most cases what we're going to find. Okay, and 10% there is an improvement, 40% there's no difference, and 50% are worse afterwards, after the operation. And that was around 1990, 1991. Okay? Okay, I think it's slightly different with the keyhole surgery now, but that was then. So then it was like, that was the end of when I decided not to have that operation. The insurance company were upset that I didn't go for it, and so they sent me for intensive physiotherapy as an inpatient in a hospital just outside London. So that was an eye-opener, because was already on the training course at that time where I got sent to the... and then what I noticed is that there was 2 things. They had posture classes, okay, and the posture classes was the orthopedic surgeon going round to all these people with back problems and basically putting their hands on their shoulders and kneeing them in the back. Okay, honestly, this is what I watched it. I was there. Okay, and most of the patients crawled out of the session with tears coming down their eyes, as though that was going to do any good. And the last thing that you did before you were discharged is you had a general anaesthetic, and then they manipulated the limb that was causing the pain under general anaesthetic, and people were waking up in extraordinary amount of pain. Okay, that's what people were kind of putting up. So I wrote, basically that was the thing. Before that, I thought, well, maybe the chiropractor, the osteopath, maybe the physio, maybe this, maybe that. Went down the route, and then it was the Reiki and the spiritual healing and the homeopathy and the acupuncture. I know quite a lot about all of them because I kind of went down there. Now, there are certain things that did help, but only short term, and I mean short term. It was just maybe a few days at the most. And then this searing pain down my leg, sciatica, lower back pain just kept coming up. So I just happened to, I couldn't work anymore. It was so painful sitting. So I ended up being out of work, couldn't do anything. I was told never ever to lift anything ever again. And then I just happened to move in to a house where there was an Alexander teacher. He was just sharing this cottage. And in the brief meeting that we had when I first moved in, I said, "What do you do?" And he said, Alexander technique. And I'd heard of it in actors and musicians. And he said, well, maybe it can help your back. So it was a bit like saying, well, maybe if you go to Tesco's, you get some relief from Tesco's. I mean, that's what it was, because I had no idea what it was. And then I said, well, what is it? And I remember distinctly, we was sitting in this living room, and there was a kind of open fire, and we sat for 45 minutes, and he was Scottish, and in a very strong Scottish accent, he told me all about the OA joint and, 45 minutes of what the Alexander technique was, after which I got up and I thought, what is this person talking about? It made no sense to me whatsoever, okay? And it was only because I was actually living there that his partner came to stay, and she said, I'll show you. And within 10 minutes, I got one of the most amazing experiences of my life, okay? And then I started having lessons. The guy's name was Danny Riley. And the first thing he said to me is practically, do you always sit like that? And I said, what do you mean, sit like what? And he said, well, do you know how you're sitting? And he showed me the mirror, and I was sitting pretty much like that. I was way off to the right and twisted. And then he just got my head and he put it to what I know now is straight, and I felt like I was doing that. I really felt like I was doing that. Okay, and the other thing that actually happened when I felt like that is the pain started to get less. Immediately there was a kind of a connection. And then I realized over a few lessons, that's how you sit when you teach people to drive, because you have to look at the road and you have to look at them looking in the mirror. So for 10 years I've been sitting like that. But what was the most interesting thing of all that? The chiropractor, the physio, the orthopedic surgeon, my father, pretty much anyone had missed it completely, missed the obvious. Okay, and that's what was so fascinating about what the lesson was about. How could all these people miss? And then I thought, well, they're not looking at the cause, they're looking to fix. But you can't fix something unless you know what the cause is. And that's what makes the technique so unique. So within maybe about 3 lessons, I decided that I would go down and become an Alexander teacher, because it was such an amazing thing, not because it was so short. If I had gone to them straight away, I wouldn't have thought it was because I'd been in pain for about 7 or 8 years, and I mean a lot of pain. Okay. So like I mentioned before, I went down to Totnes, did the training course, and then started to do the classes. And of course, people came up to the end and said, "Oh, this is really interesting. Can you advise a good book?" And at the time, the Chris Stevens book was out and Michael Gell's book was out. So I had a copies which I used to lend out or told them to go and get a copy. And I was actually amazed because they came back and they said, "Oh, this is far too complicated for me." Now, as Alexander teaches, we read it and it's all making lots of good sense. It's actually, but for somebody who was brand new, it was too complicated, the concepts. So then I saw kind of there was a kind of a gap, but for some people to have something who did not know anything about it at all. So that's why I wrote the first book. Not because, I mean, if somebody said, "Oh, you were," I mean, I never saw myself as a writer. I mean, I can't spell and all the rest of it. But there was actually a need, okay? And it was that need that actually came about. I've also noticed that since I've been doing, and I still do the classes because I feel I want to keep in touch with people who are in pain, who would need this. I have noticed that more and more and more people actually come for postural related problems. Even if they have a back pain, they know it's their posture. Okay, if they have this, they know it's their posture. And whether we like it or not, people are seeing us as the posture experts. Okay, so even though we don't like the name, okay, even though Alexander didn't like the word posture, people are still seeing posture as being important, even when they don't know what it is, even though they don't realize how far-reaching this word posture means, because it is our whole identity. Okay, it is the way that we use our body, it is the way we think, it is the way we have emotions. You know, you don't see anyone sitting like this saying, "I feel very depressed today." Okay, what they do is "I feel very depressed today." They're actually depressing their bodies. So even mental conditions are actually caused or exacerbated by posture. So posture is actually really, really important, but what we need to do is educate people to realize it's not just shape or position. It is far more fundamental than that. So basically the reason I wanted to call the book this is for people who did not know anything about the Alexander technique to actually be drawn for one reason, and they will get something else. Because I can imagine people will buy it to think, well, I wonder how I do sit up straight without being in pain, and then they hopefully will realize it's nothing to do with that. And all the books I've actually written, it's just basically a transportation to get somebody from A to B. I had one person, I think it was on the Amazon site, said, "Oh, this book just sounds like a big advertisement for the technique." And I thought they didn't like that, but I thought, well, that's it. Is that exactly what it is? Okay, it's exactly what it is, because that's how, you know, whether it's in a magazine or whatever, that's how people actually come. And so I enjoy the process of writing. It's actually been interesting for me because it actually educates me, and it also gets me thinking, how can I explain these ideas to people who don't know? And I always like the saying that Alexander said, "I could explain my technique to a 3-year-old in 5 minutes, but give me an adult and God help me." Okay? Okay? And so I just thought, well, if he can explain it to a 3-year-old in 5 minutes, it must be simple. And maybe we're making it more complicated than it really is. Okay? And Marjorie Barlow, in her books, I had one workshop with her once, but apparently she used to say, all you have to do is make sure you know what you're doing and make sure you can stop doing it if you want to. Okay? How more simple can you get than that? Okay? So, that's what I hope. I hope it doesn't sell a lot of books so I will get lots of money. I hope it will sell a lot of books so it will get the people out there who've done the 3-year training to get enough people to keep them in work. I really do. That's my only, because I wish I'd known about the technique for about 10 years because of that pain. So that's what we're actually here to do. We're here to relieve people of their pain, mental, physical, emotional. Okay? And there's a lot of pain out there. People are very confused. They're kind of wandering out, just completely lost the way. And for me, the technique helps people to put a little bit of meaning and purpose back into their lives.